I was having some left-sided pain. I went to the hospital and told the doctor my symptoms. It took a while for the CAT scan results to come, and when he came in, he told me, you have a mass on your pancreas, and it's in your liver also. Being a nurse, I told him, I feel like you just handed me my death sentence. The oncologist said with no chemotherapy, you have 6 months. We tried the chemo, and it wasn't working. I describe it as the old-style desk calendars, and you rip the month off. Like every month that went by, I was ripping how much longer I had left.
From the research that I'd done, I knew the 1-year survival rate for pancreatic cancer was somewhere less than 1%. The survival rate in a man who's 80 years old who has stage 4 is a whole lot less than that. Having gone through cancer before with my wife, she was diagnosed with breast cancer, and we spent more than 10 years fighting her cancer situation. It was a difficult time. Here in Orlando, there were no clinical trials. We just came up with nothing until we found the one trial at Ohio State.
Our team fully knows and understands and embraces this idea that patients come to us looking for hope, and we may be their last hope. And at the end of the day, everything we do starts and ends with the patient. And if it's not helping patients today, then we're not doing what we're meant to do.
You know, I didn't want to get my hopes up too much, but once I did start it, I felt a great improvement. My energy level immediately went up, which made me happy because quality of life means everything to me. And being able to do with my kids and my grandchildren.
Dr. Roy Chowdhury said, I think we can probably figure out a way to get it done so that you don't have to be here. You can stay in Orlando. You can do all the blood tests and scans locally. It was the first day that we'd had hope in quite a long time. Hope is a magical thing.
We've been fortunate to see a handful of patients over the past 8 years who've had pancreas cancer and an FGFR gene. And then we realized telemedicine is one tool that we can use to reach patients that wouldn't otherwise be able to enter a study or a clinic, for example, that specializes in FGFR. Thanks to Doug and his therapy now, and Beth and her participation in our study for blood, we're opening a new study this summer for a telemedicine-enabled clinical trial to deliver therapy to more than 40 patients across the country.
Oh my gosh, that's awesome. That brings tears to my eyes. I'm grateful for them to be able to have the same opportunity.
All these people are going to become part of this journey, just like I'm part of this journey. And if it can be done by telemedicine, there's no end.
In the field of precision oncology, we're redefining how to choose therapies for patients. So we've realized we have to show the pharmaceutical industry how to do it. And it's critical to make these big leaps forward for patients like Doug and Beth who don't need something incremental 10 years from now. They need something today. And that's what a donation to Gateway can accomplish, a leap forward.
Since the clinical trial, I just didn't know it was going to be as good as it really ended up being. If without them, I wouldn't probably be here right now. I feel like they gave me my life back and hope to watch my grandchildren get a little bit older and hopefully be here long enough that they'll remember me. There's no words to express the gratitude, and it's overwhelming to be able to receive it. I feel very, very grateful.
Gateway has enabled me to go from the point in time where I had absolutely no hope whatsoever, and it looked like I had maybe a few months to live, to where I am today, literally thriving. I get goosebumps.